going to talk about LGS associated disorders, and I love that I still get to dabble in the research. Thank you so much for sharing Caleb's journey with everybody so freely. We really appreciate it. So LGS associated disorders, you guys all know what they are, and they're so important. LGS is more than seizures, you know this. There are many common associated seizures, and the number one question we get in the Facebook is really of the flavor, have you ever tried this medicine, seen this thing, know about this rash? Is this common in LGS? And yes, the answer is usually yes. And then what does this mean for your care? How do you spot them? What do we ask? And really up until this moment in history, we have been exclusively focused on treating the seizures. And we knew all these things were problems, but you know, we are trying to understand what LGS was and focusing on the seizures, and that is going to change. It is so much more, and we're now ready to start naming the LGS-associated disorders so that we can treat them. And hopefully by the end of this talk, I can convince you that the best care now involves knowing the LGS-associated disorders as well as the LGS-related disorders that you are dealing with, looking at the whole clinical picture, the whole child or adult, and then designing treatment around that and your goals. That is the best care today. And in the future, we're going after disease modifying, but this is for the best care today. So there's already a group that has really pioneered this, one of my favorite groups, the TS Alliance, Tuberous Sclerosis, and they have something called TAND, TSC-associated neuropsychiatric disorders specifically. And so we're a bit more general, we're looking at beyond. And what they have learned from really pioneering this effort on TS-associated disorders is that you have to name it, you have to screen for it, and you have to act on it. And so they have been doing this for well over a decade, naming all of the conditions. They have tubers throughout their body. So interestingly enough, about 30% of people who have tuberous sclerosis evolve to develop Lennox-Gastaut syndrome. So there's a huge overlap, but they also have issues with their lungs, wherever these tubers form, and they have issues with their kidneys, they can form in their brain. And so we're really learning from them, and they're mentoring us on this. And so the landscape of LGS-associated disorders can be broken up in a lot of different ways, and we often think about them in terms of cognition, thinking, and communication. We think about behaviors, we talk about that a lot. We talk about sleep, we talk about movement and physical care, feeding and GI, and mental health and family. And these are the ones that get the most attention, but there's some things that are not on here, right? And so we want to start bringing those things up. And this is actually a more accurate clinical picture of what happens in LGS when you search the literature. You've got the brain and neurological, and this is very much in medical speak. Then you've got speech and communication difficulties, behaviors and psychiatric issues, cardiac issues, sleep issues, feeding issues, movement and gait issues, continence, incontinence, and daily care issues across this, right? And again, some are still missing, as you're going to see from this. And so we need to begin to name these. We need to begin to talk about them as we go, and the core study in our Learn from Every Patient database advances. We'll start to figure out how common they are across all of us as you guys fill out your surveys and let us know, well, how often are these issues and that. And you can see not only have they been lumped into these boxes, but they start to actually break down into the thing that's wrong. What is wrong with sleep? Irregular sleep patterns, nocturnal seizures, trouble regulating temperature, heart rate, blood pressure changes during sleep, temperature sensitivity, including seizures at night as well. So they have trouble falling asleep, staying asleep, they're sleepy throughout the day, excessively. So all of these things need to be named, then we need to screen for it once we've named it and understand it, and then we need to act on it. We have a long way to go, but we're ready to move this along. If you were in Workshop A yesterday, we pioneered maybe is not the word, we introduced, we don't know how people feel about it yet, but a new acronym called DEE signs. And if you've heard me talk about this yet, I feel like we need a rap for it, like, no, do you know your DEE signs? But it's an acronym that talks about 8 things that we think you really need to understand And I'm not going to go into this, but if you know, so like the D stands for developmental delay. Do you have it? Is it moderate? Is it severe? Is it profound? And what does that unlock for you? So this QR code here, if you guys want to grab it, talks about each of these letters, what they mean, but more importantly, they talk about what it unlocks. Does it unlock a treatment, like a medicine or a therapy? Does it unlock referrals to another specialist? Does it unlock social services? Does it unlock financial services that you might be able to get? And the first E is for epilepsy, the second E is for EEG, and then you've got seizure types, intractability of your epilepsy, genetics, syndrome is the last S, and the N is non-seizure issues. And we know that your loved ones can have 3, 4, 7, 10 non-seizure issues. So this is a complex picture we're painting, right? Good treatment now requires you taking all of this into account and all the non-seizure issues. And the sad state of the reality is yes. But this is LGS. We can do hard things. So we're going to do what's best for our loved ones. And what we're looking for is really this whole patient care. This is the ultimate end goal for us. We don't want to just be looking at seizure-only care. We really want to be looking at whole patient care, which will open up treatments and therapies and school and social benefits, home supports, specialists that we can get into, and better daily life. All right, so I'm going to go through these pretty quickly. What have we actually, what's under each of these? So intellectual disability is common in LGS. 1 in 5 are mild to moderate. The others are moderate to profound intellectually disabled. About 50% are nonverbal. Things that can help are speech therapy, devices, and carefully choosing the anti-seizure therapy. And this is going to be true for all of them. Some of these therapies make sleep worse. Some of them make communication worse. Some of them make attention worse. And so being able to choose, and our doctors do this already sort of in their heads, but we need to be thinking about it too. Behavior, hyperactivity, anxiety, things that can help. Behavior is communication, especially in your nonverbal ones. You know, I'll hear doctors occasionally say nonverbal, means they can't communicate. No. Nonverbal, if you have a nonverbal level, and they can communicate. Their behavior is communication in those with challenges and healthy. Considering the right seizure treatments if your kid has behaviors is crucial. Changing the environment, and then of course, as they talked about that behavioral guide that came in your bag to read through that, what are LGS families experiencing and what have their life hacks been? Sleep, nighttime wakenings, daytime sleepiness, where you have Dr. Gupta up here. She's going to come and talk more about sleep, which is very exciting. Ask for a sleep evaluation and get the sleep report, which I believe was also in your bag and was talked about by Tim when he was up here earlier. Movement and physical care, falls and injury from drops, needing daily care help, lifts and things to move them from the bathtub to the bed, equipment that reduces harm. So things that can help are equipment, safety planning, and sometimes we can use PT and OT to help strengthen our loved ones to try to increase their mobility, especially when they're brand new in their journey. Don't let anyone tell you that your loved one can't have PT and OT because it's not going to help. Keep pushing it. Savannah had it all through school, and it made her stronger. And I remember the day we were at a water park and with Make-A-Wish, and she was hanging from a rope over the water, and I'm like, ha! Her physical therapist made that happen, and we sent her that picture. Feeding and GI and medical, so feeding can be really hard, G-tubes, coordinating feeding care and GI, seeing a specialist, considering the seizure meds again, are all really important things that can help. And then mental health and family, caregiver fatigue and burnout. And so we have resources like respite and peer support coming to this, going to our online support groups that happen every month or two, and then being in our online Facebook group can really help. And then next year, we're really looking at starting to do meetings regionally around the U.S. initially, and then maybe abroad as time goes on. But and we're launching an app this fall that will help connect people to you locally. So these types of things. You cannot help your child until you put your face mask on first. When you're on an airplane, they say put your face mask on first if you need oxygen, and then put it on your child. And when we look at that and go, when are we supposed to take care of ourselves? But we need to take care of ourselves. So this matters, right? Measuring all of these areas, but there have been studies, and when we've asked you as families, Fewer than half feel like these are adequately addressed at your appointments. And it's because your neurologist isn't necessarily able to deal with all of these issues. You need your specialists talking to each other. The system's not necessarily set up for that. So whole life care means treating the disorders, getting specialists to talk to each other, considering the whole loved one. So what you can do, we can track the whole picture and think about the whole picture, because it's really hard for the system to do that in a single doctor. Ask for screenings when you need them, use comprehensive care, and lean on this community. You're not alone on this journey. There's our Learn from Every Patient database, which you guys have heard about. Our supports, we have a financial resource toolkit to help you. But really, you are going to be the quarterback for your loved one's care. And that is just the reality. And you're going to be the one sort of trying to get all the specialists together. And then slowly, this generation, especially the generation who has adults, we're going to change the future for the ones that have young ones here as we move it along. Now, one of the things I did not talk about at all on this list is lung and breathing issues. And that's because it's not in the literature. There's a few short sentences, but we have a very special guest here today, Dr. Schechter, who's a pulmonologist, who came to our scientific meeting last year and agreed to come and talk to you as we start to bring that topic of what happens in breathing and respiration in the lungs of our loved ones